Okay, so Bonnie Daniker?
Yes.
Did I pronounce that right? Okay.
Right.
So Bonnie, tell the good folks here where, what company you're with and what you do.
Thank you. I'm CEO of Right Advisors. We are a literary consultancy and transmedia company, and about 40% of our business is in the health and wellness space. So we're very interested in staying abreast of the modern updates of what's happening within health and wellness, and that's why we're delighted to be with Health Connect South.
Right. And so what, have you heard any interesting sessions yet, or are you just arriving now?
We've heard a couple of interesting sessions. There's a lot of collaboration between academics and pharmaceuticals and hospitals and so forth that you mentioned earlier in the introduction. Mm-hmm. But what I've seen is how we can structure our medical care. They used a lot of the instances for Ebola treatment and training to see if we can stretch and expand among other disease types into the cancer realm, which is, of course, big interest to my company and myself, considering that I've written 5 books on caring for cancer patients and have a huge background of knowledge in that field.
Wow. There was somebody who talked about cancer and the origins, but also some latest advancements and things. Did you happen to catch that at all?
Right. Actually, this is the program right here, the Cancer Genomics, Big Data, and Precision Medicine. Mm-hmm. The idea behind that is that we're able to take the amount of information that we have per patient and make individualized decisions on their care. So this is not only when they have been diagnosed and in their treatment care, but pre-diagnosis, so we can kind of estimate what are their likelihoods of getting certain kinds of cancers and then how we can treat those cancers and what those outcomes will be. So it's quite fascinating when you think about the genetic data that's available to us, the environmental data, and of course the patient precedents, the histories of how we've seen cancer in the past and how we've treated those patients, and that really gives us more information on how we can treat our patients in the future.
That's awesome. Well, great. Are you looking forward to some more sessions this afternoon?
Absolutely.
We have one of the Ebola patient survivors.
Exactly.
Who's going to be our keynote speaker today, right?
Right.
And that's going to be real interesting. And then some other panels, more about, I think, data analytics and big data that's going to be in the afternoon.
Right, of course. And again, this is all so that we can inform ourselves to make better decisions on how we live and how we work within these diseases, and really integrate how much information we know into what our life is meant to be and how successful we want to be, even though we are living with these challenges.
Mm-hmm. Right, very good. How could people find you, Bonnie? Like if they want to learn more, you said you had 5 books. So
yes, I do.
So if somebody wanted to maybe learn more about those books or the purchase or whatever, how do people find you?
Thank you. So my company is Right Advisors. My email address is bbdaniker@rightadvisors.com. You can also, of course, look on Amazon for the books by Daniker on caring for cancer patients.
That's great. Well, thank you so much
for
sharing.
You. Take
Looking
care.
Forward to more of your innovations and things like that. So thank you. So you just heard from Bonnie Daniker, and we're going to be having another guest come up in just 1 more minute to talk about his live streaming healthcare app. And so he's going to be coming up right now.